I'm Shane Richter, Operations Coordinator here at Recovery Café Spokane. I am pleased to be introducing a video produced by SAMSHA, the Substance Abuse and Mental Health Services Administration. The episode we have for you is called Developing a Sense of Purpose in Recovery. In the next hour, you will learn why purpose is so important to success in long-term recovery.
Hello, I am Matt Clune, a person in long-term recovery, and your host for today's episode of Road to Recovery. Today's topic is developing a sense of purpose and support for recovery. We will discuss what it means to have a sense of purpose that sustains recovery and explores the various ways in which people find meaning and a purpose to their lives. Joining our panel today is Oryx Cohen, who is Chief Operating Officer of the National Empowerment Center in Lawrence, Mass. Paolo Del Vecchio, who is Director of the Substance Abuse and Mental Health Services Administration Center for Mental Health Services, U.S. Department of Health and Human Services. Gail Saylor, who is a licensed and clinical professional counselor, a certified rehabilitation counselor, and master addiction counselor. She is also a board-certified intervention professional and founder and CEO of North Star Academy right here in Rockville, Maryland. Gail is also a national and international trainer for ARISE, Continuing Care with Intervention. And last but not least, Kabir Singh is a certified peer recovery specialist who's working in the state of Maryland. Welcome. I'd like to direct the first question to Paolo Del Vecchio. I think everyone on this panel recognizes that there are many dimensions to recovery. The purpose of this first bit of our dialogue today is about that dimension of purpose, purpose in recovery. So, Paolo, if I might, what do you think it is about finding one's purpose specifically that is so important to gaining and sustaining recovery for the long haul?
Thank you, Matt, for that question. And to me, at least, purpose is one of the most important aspects in our journeys of recovery. It's about finding meaning in one's life and one's experiences, including our addiction and mental health problems as well. It's that sense of purpose helps us get up out of bed every day. It gives us the incentive, the motivation to try to improve our lives and improve the lives of others. For us, when we look at purpose, it's all about hope and providing that hope for a better future. And really, as hope, as we know, Matt, is the catalyst of the recovery process. And that's what purpose really brings to it.
Kabir, I'd like to follow up with you. So we've realized that this critical ingredient of recovery called purpose is so important. How do you think that changes in one's life over the life cycle of a person's journey in recovery?
So it's been my experience that those who enter into recovery start off with lacking purpose and are hopefully able to develop and foster that over the kind of process of recovery and be able to discover themselves, some through various ways of 12-step fellowship or different accesses to recovery, are able to develop into their own person that they were always kind of meant to be. And so that for my experience has been the meaning behind purpose is the self-discovery.
Gail, especially in your present role with North Star Academy, on a day-to-day basis you're dealing with young folks who are searching for recovery. And I'm wondering if you could shed a little light and insight on what some practical activities that you may use in the everyday clinical environment to engage and help your clients to find purpose.
A lot of the kids who come to us come with really feeling like they have no hope, they have no purpose. They feel like they failed already. First, we help them try to reconnect, because in many cases, as connected as they think they are through social media, they're really, really, really disconnected. They're disconnected from themselves, their peers, from the community at large. So we really try to spend time helping them understand that and looking at what makes them special. What is it that you can get excited about? What is it that would make you happy? Not your parents, not your teachers. What is it that would make you feel like you've accomplished something?
Oryx. Many of us in recovery, and for those in the field, we know that for some, faith and spirituality plays a role in their recovery. Would you care to expound on that a little bit?
I can say that it's played a role in my own personal journey, finding some purpose or connection through spirituality for myself. So the way I see it is, and I've seen it over and over again with people, that whatever their faith is, their belief system, religion, whatever it may be, that having that faith and that belief in a greater power is so important to them in their recovery. Mm-hmm. And it's not something that we talk about enough, I don't think, in our recovery movement. I think sometimes there's a wall that gets created between maybe people who are religious and people who aren't religious. I think it's more about having a belief system, because even if you're an atheist, that is a belief system. That's a way of looking at the world, and to have a really centered way that you see the world that helps you to make sense of things is important for anyone.
Do you think that's a moral compass, that whether a person is religious or not, finding their moral compass, their North Star, we use North Star for that, but just finding something that they can attach to that has meaning?
Yeah, and I think you're right that a lot of religions have and belief systems have this common have a commonality, which is developing this moral compass. And so no matter what your belief system is, it just seems to be kind of a positive part of humanity, that we all tend to know what's right and wrong, and to have a belief system that helps support that and nurture that is important.
I think the other thing that really adds to this conversation around purpose is the importance of social supports, and the idea that we don't recover alone or in isolation, but we recover through relationships and supports in others, and how other people, Gail, I think what you said about helping find those youth passion. How can providers, family members, and peers, how can we identify what's really important to people? What are their goals? I mean, this is where the social supports and relationships can really help foster that sense of purpose in others.
Yeah, and if I could dovetail off of that, I've seen there's a great deal of anguish and anxiety surrounding gaining employment in early recovery. And so, that kind of purpose that's linked to finding meaningful work is a great obstacle. Some have developed records with, incarceration and such. Mm-hmm. And so there are movements being made, towards helping those in early recovery who have, felony records and programs in that sense. But that's a good large component of it.
What do you do with that intractable client that you just can't get to turn because they just don't believe in anything? They've lost faith in it all. They come from a horrible environment, perhaps poor role models. And have you found any tricks of the trade along the way that have worked for you in turning that client in the right direction?
I would say that one is to acknowledge that we can't fix it. That what we can do is help them develop a toolbox to deal with it, and help them begin to. I always say to an individual, whether it's a teenager or a 60-year-old, if I can change the way you're looking at it this little bit, I can change the way you respond to it this much. So it really, to me, is just getting that little wedge in the door
think there are also, there are certain tools,
Sure.
person-centered planning
Sure.
being one
Absolutely.
critical one to help people identify what goals they want for themselves, what's most important for them. I also think this is, again, where peers can play a
Absolutely.
really critical role in finding role models to help people who may be, still early in their journeys of recovery and don't know what's possible. Mm-hmm. Having a peer as part of that treatment team can really make the difference.
Can I just say one thing about adolescents in this regard? Because one of the things we deal with is, when anyone has a baby, that in their heads, they're laying with their newborn baby, and part of them is dreaming about the next 25 years, and then something interrupts. And one of the most important things I've found for teenagers is for their families, their parents, the people who they really care about, to understand that everyone's journey is not the same, and it's not a race, and we don't have to go to college next week, and maybe going to culinary school is really your passion. Really helping people understand and let go of kind of societally imposed expectations on kids.
That goes for adults too.
Right.
That and I love what everybody's saying about this. I think that person that we're finding very difficult to be motivated, to be inspired, whatever, that we need to be asking more deeply what is it that they want out of their lives, rather than what do we want out of their lives. I think that can be a tendency that we have, is okay, is this for me or is this really for them? And to shift the focus back to people. And we have the belief at the National Empowerment Center that all people are whole, that it's just a matter of, and all people want to have purpose.
I really like the way you flip
tapping into that.
Absolutely. Mm-hmm. And what a great way to kick off this panel. Some wonderful ideas, and we will be returning soon.
The original On Our Own group started in 1981 by a lady by the name of Peg Sullivan. Actually, the name On Our Own is taken from a book written by Judy Chamberlain. It's called On Our Own, Ex-Patient Controlled Alternatives to the Mental Health System. We're a statewide mental health consumer ex-patient advocacy training network, primarily composed of people who are either current or former recipients of mental health and/or substance use services. We've now established what are called peer-run wellness and recovery centers, and we have 23 of them throughout Maryland. We operate various training programs. We have a Wellness Recovery Action Plan.
Wellness Recovery Action Plan, WRAP, is a program that a person develops for themselves to help them get well and stay well, however they define their wellness. WRAP was originally developed by people with mental health issues, but it turns out that WRAP can be used for anything.
You can actually be empowered by participating in a WRAP program because it allows you to take control over. That's why oftentimes I can remember not feeling like I had any control. It was whatever this counselor said, whatever this doctor said. And so you can actually participate in your own well-being as it should be, because you know what your thoughts are, you know what you're feeling better than anybody else.
It's a plan so that when you start to feel yourself, in AA, they tell you that your relapse occurs well before you start to drink. And this actually identifies those feelings and maybe behaviors that you're starting to slip into that will lead you back to the bottle or the pills.
And we also develop what we call the Wellness Toolbox, which is an array of things that you can do on a daily basis or throughout your routines in life that whenever you feel like you're not well, is an indicator that, hey, this is something I can do. For instance, running.
There are 5 key concepts of recovery, according to Mary Ellen Copeland, which are hope, personal responsibility, education, self-advocacy, and support.
It helps you build a plan with the tools and the people that will enable you to potentially overcome not only potential fall downs, but also help you build your life if you see all these tools and people that are helping you, that you can focus on those things for a better life.
It has taken off like wildfire since we launched it. It's a wonderful program. It has impacted a lot of people. There are so many folks in our system who are utilizing it and who are helping to spread the word.
Before Wellness Recovery Action Plan, I was looking for people to fix me. I was looking for everyone to do the work for me. When I took Wellness Recovery Action Planning and understanding that personal responsibility is one of those key concepts to recovery, once I started to take personal responsibility for my recovery, things started to change.
Another area of purpose is for them to take some of the experiences that they've been through and then help other people. So whether that is becoming a RAP facilitator or providing peer support in one of the centers.
Everybody that works here has had a personal experience in some way with the mental health system or mental health or substance abuse disorder. And so we are here to help others who've gone through similar circumstances or are dealing with similar issues.
Those of us who certainly have come through and have needed and implement and work a daily maintenance plan and RAP plan of our own are the best persons to stand and be able to kind of share that.
Being able to share not only my story and the hope of wellness and recovery, to be able to let people know that you can get past those things. You can have the life that you want.
When you're surrounded by a community that's really aware of that and looking at that kind of issue, what you can do with your life and the purpose that you have and the things you can accomplish expands.
You might not know everyone in your community, but if you did, you'd see that people in recovery from mental and substance use disorders are all around. Reach out for support and begin your recovery journey. Join the Voices for Recovery. Strengthen families and communities.
For confidential information on mental and substance use disorders, including prevention and treatment referrals for you or someone you know, call 1-800-662-HELP. Brought to you by the U.S. Department of Health and Human Services.
Welcome back. We started the panel off with kind of the plethora of activities and practices that are available to youth, young adults, and older adults in recovery. And now I'd like to take a turn and look at what are some of the barriers and obstacles for individuals who are seeking recovery, no matter where they are on their journey, and finding meaning in their lives.
Stigma is kind of a massive barrier to entry into recovery, especially with the younger, and I'm sure Gail can probably speak to that, the younger population that, seeking recovery and kind of hanging up the spurs, if you will, at age 15, 14. If it's difficult. It's a difficult place to be a young person and find yourself in a treatment center at 14 or 15. And is this it? Mm-hmm. All the fun's over. And so, and the stigma that's involved with being mm-hmm. labeled an addict or an alcoholic or a person in recovery is just kind of a very large barrier to the entryway into the hallways of recovery.
I would say the same thing is true of young people and adults who are entering because of mental health problems. Stigma, what are other people going to say? What I hear a lot from the children in the program is they're talking about me back at school. They want to know why the rumors around that I was in the hospital, the rumors around that I was using drugs. It's very, very hard for them to acknowledge it. And in most cases for kids, it wasn't their choice to come into treatment. It was their parents' decision. And we have to respect that and hopefully get them to look at why it's important for them now. Same thing as with a young adult or an adult. Why now? Why do you need to be here now? What can we do to convince you that you have a future and that everyone wants to get well? And if you could have done it alone, you would have done it alone. No one wants to be in this kind of pain.
These negative attitudes, it really is, thank you so much for bringing it up. It's so central to this recovery journey as well as this pursuit of a sense of purpose. And if you think about for those of us with serious mental illnesses and serious addictions in particular, the attitudes, how that gets translated into discriminatory practices, for instance, when you're going in to seek a job or when you're in school and trying to pursue your mission. And it's also perhaps the worst is when we take these attitudes on within ourselves and we start believing ourselves what we've called in the past self-stigma, where we feel ourselves that we can't succeed. And so this again is where providers, families, and peers can play such a difference in terms of correcting those myths and making that message be, yes, you can, in fact, succeed in your life.
Yeah, and I agree with what you've said. And I think also from a broader perspective, it's important to recognize kind of root causes. And we have to talk more about poverty and trauma and racism. And these are significant barriers to people recovering. It can be easy to kind of from an ivory tower and say, oh, everybody should have a certain life, and why aren't they achieving what we think they should achieve? But we need to recognize these real societal problems, and I think whatever we can do from the behavioral health community, substance abuse community, to engage with these other movements that are more about rebuilding our society, rebuilding our communities, creating more opportunities for people, that will only help.
More empathy. More empathy.
Yeah. Seeing things through the lens of the person who's in front of us.
And more training for people. I mean, think about your average high school kid or college kid. Their professors, teachers, they're not necessarily trained to understand the impact of trauma or other mental illnesses or substance abuse on a person's ability to study. I see young people all of the time who they're really, really bright, but because of their where they are in their recovery, because of their mental health issues, they can't access their intellect in any consistent way.
Yeah, or it could be because of their home environment.
Right.
Is really hard.
Yeah, the families and the natural supports and out there are often larger components that come into play. And one could go to a treatment center, seek treatment, or a rehabilitation center, wherever they might be, and just enter back into the same environment, which is,
Yeah, and I think that whole aspect of, treatment in the past solely focused on symptoms or abstinence, and we really need to look at the holistic needs of people. So that includes the job, the education, housing, and other aspects. Or as you noted, we know what works when it gets to helping people get jobs, supported employment, evidence-based practice. We know 70% of people with serious mental illness want to work, yet only 2% of public mental health clients have access to supported employment services. We need to do a much better job of having access to these kind of quality evidence-based practices so that we can address these huge needs.
We all know that in the substance use field that we have collegiate recovery campuses popping up all over the place, and special collegiate housing programs, Rutgers, for example, and others, that are safe and supportive environments for folks who are trying to sustain their recovery. Similarly, in the mental health arena, NAMI on Campus and Active Minds are two national organizations that have chapters around the country that are doing fantastic work. And I wonder, again, to the panel generally, how do these programs assist individuals with behavioral health conditions to help realize their life calling? And what are some of the pitfalls and obstacles that they might confront along the way?
I'll start with an obstacle. Before they ever go to college, if a young person has had problems with substances or mental health issues, then their parents need to stay involved. They need to realize that if they don't sign a release to the university cannot talk to them. They need to understand that there may be supportive services that aren't on campus and that they need to look at what is around. If their child has Crohn's disease, they're not going to send them without finding clinical and medical help nearby. We need to really get to parents to get them to make those same decisions for their young people with substance use problems and mental health problems going away to college. They need those supports because we can't say that the problem is that the collegiate recovery program or NAMI on campus are not doing their job. They're doing their job, but there are other things these kids are going to need.
Yeah, so we keep arriving at that word support. And take, for example, I'm partial to the University of Maryland as a TERP myself. They recently began a TERPs for Recovery program that's in large part handled by the students. Very little staff involvement, funded through grants, and it's normalizing recovery on that particular campus in College Park. They just had their first sober tailgate, which I attended. It was a fantastic turnout, and hopefully they plan to have them again. And so normalizing the recovery experience. There was a great number of people that particular day that were walking by the sober tailgate. What's this? And of course we had free T-shirts, which were the hook, and they were giving those out. And so, hey, what's this? What are you all doing? What's this about? So it was normalizing it. Is a big piece to it.
I think, college age years are so critical, and we know for people with mental health problems that's the age group that has the highest prevalence rates for mental disorders and yet has the lowest help-seeking rates at the same time of any other group. So the importance that these groups like NAMI on Campus, Active Minds, the explosion, frankly, Matt, in recovery schools around the country and how exciting that work is has been certainly a hallmark over the last 5 to 10 years. And I really see the future being really bright as those kind of programs prosper in every university, frankly, across the country.
Absolutely. I'd like to put a punctuation on that point, and we will be returning soon.
I've experienced both mental health and addiction issues for most of my life. My hardest time was when I was a young adult. For me, I felt my life wasn't worth living. I was completely despondent and actively thinking about ending my life. Found myself on a subway platform in North Philadelphia, ready to take the step. I could feel the train approaching and the light coming down the tunnel. Just as I was taking that step in front of that train, the thought of my mom held me back. And I say this because the importance that family support really brings to recovery. I left that subway platform and I went to local counseling center, told them I was in crisis, and they told me, come back in a month, we have an opening then. How many times do we turn away people who may be in need? But what I found there changed my life. It was a sign on the door of that program for a job. And it was a job helping to staff a local mental health and information and referral line, what we'd probably call a warm line today. And I found 3 things by doing that work study job. One, I found that I wasn't alone. There were so many other people experiencing mental illnesses and addictions in my community. Second thing I found was that treatment can be effective, it can work. And as a result of hearing from other people, I went and sought help myself. Third thing I found is that sense of purpose, again, that by helping others, we also really help ourselves. To be able to help other people helped me kickstart my recovery journey in full gear. And from that time, I went on to dedicate my life and my career around mental health and addiction issues. One of the biggest barriers continues to be the negative attitudes, what we've called stigma. Too often we're told that we're not capable of working, we're not capable of going to school. And again, the evidence shows otherwise, that if we're given the right supports, we can be outstanding employees. We can go on to get higher education and enrich our lives. If you look at what kind of ingredients a provider comes to the table with in terms of helping individuals they work with pursue purpose, that the most important thing really is to ask the individual themselves, that it should be person-centered, person-directed, helping to identify what goals that particular wants, not only about their treatment and symptoms, but goals around life, be it looking at a job or education or social supports or other aspects of what really drives that person. What does that person really care about? So those would be the hallmarks of a provider who could help a person find their dreams and pursue their dreams. I mean, to me, that's what makes an outstanding recovery-oriented clinician and provider.
Making just one connection during recovery from mental and substance use disorders can put the strength of family and community behind you. We're all connected, offering encouragement, support, and hope. Join the Voices for Recovery. Strengthen families and communities.
For confidential information on mental and substance use disorders, including prevention and treatment referrals for you or someone you know, call 1-800-662-HELP. Brought to you by the U.S. Department of Health and Human Services.
I'd like to welcome everyone back and pick up on where we left off. Gail, I'd like to ask you, because you're working in a practice setting, what guidance can we give clinicians in facilitating their clients' search for meaning and purpose in their recovery and in life generally?
Well, I think the first thing is it has to be very individually based. We have to look at who that individual is and let go of other expectations. If they're 27 and haven't graduated college and keep going back and forth, that's okay. What is important to you right now in terms of making your life meaningful? If they're a junior in high school and the great fear is if they go to treatment, they're not going to graduate on time, how do we help them look at what's important in their life right then, and that they guide us? We have to trust that these adults, young people, are really able to guide us as clinicians and tell us what they need. They may not be able to say it in words, but if we spend the time and we are open as clinicians and let go of our expectations, I think we'll hear it.
Terrific. Are there special exercises or activities, workbooks that we can think of that are used with clinician and client to help guide them through this process? Anyone?
So as a person in recovery, and maybe not through the lens of a clinician, is certain smart recovery workbooks that they have out there. So, in 12-step recovery, there in one of the fellowships, there is a step working guide. It's very simply outlines questions attached to each step and guides the individual through that process of kind of what I spoke about in the first segment, that process of self-discovery. Mm-hmm. So, of course, if drugs and alcohol were the answer, what was the question? So you kind of get to the root of that. And for many cases, and I think Gail touched on it and others have here too, there's underlying mental health diagnoses. Mm-hmm. And those aren't often so easy to just pick up a workbook. And so it's a dual individualized approach, I think, as Gail talked about.
Absolutely.
Matt, if I could just add here, there certainly are specific tools as well that clinicians can help employ. I mentioned person-centered planning in the earlier segment, but also wellness recovery action plans is another means to assist people identifying their particular goals and then developing strategies to help achieve those particular efforts. Another one I would mention is recovery-oriented cognitive therapy. So this is a particular effort we're rolling out now in 6 states around the country. Takes cognitive behavioral therapy approaches and really applies it to people with serious mental illnesses, and with a major focus on what's important to people and how we can focus therapeutic efforts specifically addressing what people's needs and preferences are.
I would recommend a training that we do, which is called emotional CPR, and it applies to everyone. So we've done several trainings with clinicians and with people with lived experience. I think one of the barriers is there's often a divide between professionals and the clients that they're serving. And one way to get through that is another training that we do called Recovery Dialogues, which is basically just about getting people in a room, having a conversation from everybody's perspective, whether you're a professional, you're a client there. It humanizes people, it helps to break down those barriers, and it makes, for professionals, it makes it easier to connect with the clients they're serving and to help find that purpose and meaning from the people that they're working with. So those are a couple of things that we do.
A lot of the meaning people come out of these experiences and having come through it, wanting to give back and help others along that journey. I think that's something that's really unique about mental health and addictions that we don't necessarily see in other healthcare fields or other disability groups. So clinicians can help certainly to continue to support that aspect, bringing, again, peers on as in the workforce. There's a clear way that clinicians can help and further that sense of purpose among those that they work with.
I'd hate for us to assume that clinicians are not themselves in recovery from something either.
Yes.
That it isn't an us and them.
Yeah.
And it's I think one of the most important things the dialogues or anything does is there needs to be no us and them. It needs to be a we.
Right.
And in working with the kids that I'm working with, we've intentionally created an adolescent therapeutic community where the staff may or may not be going through some of their own issues, and they're part of the community, and the students who are there feel comfortable coming to them and pointing things out to them also about their behavior and how they're responding. We got to get rid of that
Yes.
us and them.
Level the playing field, yeah.
Just to follow up on that, because people listening or watching may say, oh yeah, that's well and good, but give me an example of this happening. And right now we're working with the basically state hospital in Massachusetts. And it's a place that you would say, well, the psychiatrists are not going to have an open conversation with the patients there. That's just not going to happen. It's happening. We've pulled together these recovery dialogues. We have psychiatrists, mental health workers, administrators at the hospital, patients, peer workers are becoming involved in these really honest and open recovery dialogues, and it's been very powerful. So
Excellent.
It is possible.
We will be wrapping up and coming back in just a few short moments.
So our mission is a simple one. It's to increase the impact of recovery in our communities through education, advocacy, and training. So that means we try to lift up and talk about recovery and recovery supports that are benefiting communities, because our field has a long tradition of people in recovery not speaking out. And we think it's really important for advocacy efforts, for visibility, that we all speak out, and more importantly, that we speak out with one voice. So we do a number of trainings. The core of what we do is our peer specialist training called CARES, and it stands for Certified Addiction Recovery Empowerment Specialist.
The Georgia Council of Substance Abuse is an organization that I was introduced to 2 years ago through their CARES Academy, which means that people who are in long-term recovery acquire a certification to be able to work with our peers. The CARES Academy is 40 hours of training, and so we are just trained in the model of recovery as individuals who are in recovery view it, as well as from the medical side.
We've been able to train 500 peers to date. We have as many as 90 applications for a class of 20. And so this is really, really caught on. People want to do this work, especially, recovery has a huge tradition of giving back, and I think people see this as a way, let me get some specialized training so I can give back to my community, I can give back to my family, and give back to my agency.
Being a peer support specialist empowers me on my own journey in recovery and provides meaning in my life by enhancing my recovery. I never dreamed that the darkest places in my life, the scariest places that I've been, would turn into a way to reach people and a way to relate. It's pretty magical.
This training was different from becoming a certified addictions counselor, but in that I was able to use my lived experience, and that is the key, that it had value and it had purpose. So everything that I went through before, everything that brought shame and guilt, was the very thing that I can use to help somebody else.
I didn't know of any 800 numbers that weren't attached to a treatment program. So I said, why don't we do that and do a demonstration project and we can work with the Department of Corrections, we can work with drug courts, we can work with jails, we can work with treatment programs. So anybody who gets out can have an 800 number where they can call or text and just get a hope shot.
The CARES Warm Line is a non-clinical, non-emergency telephone and text support service that's available for people in recovery or seeking information about recovery. It's manned by recovery coaches with lived recovery experience.
If you're struggling with addiction, if you're seeking recovery, if you're a family member, we're just going to listen to you. We call it radical listening. We're not going to try to fix you. We're going to hear you. We're going to listen to you. We don't talk about this enough. And again, that's the mission. That's what we do, is we say, let's talk about it. Let's bust some of the myths around addiction. Let's take it out of the shadows. Let's talk about it as a preventable, treatable, chronic health condition, and that people do recover, because we don't get that message enough.
My story is yours. I am a mother.
I'm a father, a son,
a daughter. I am in recovery from a mental illness,
a substance use disorder.
With support from family and community,
we are victorious.
Join the Voices for Recovery. Our families, our stories, our recovery.
For confidential information on mental and substance use disorders, including prevention and treatment referral for you or someone you know, call 1-800-662-HELP. Brought to you by the U.S. Department of Health and Human Services.
The importance of employment for people in recovery from mental illnesses and substance use disorders, I just can't underscore it enough. Many people identify, like people like myself in recovery, that employment is really vital to help them in their recovery. So SAMSHA actually focuses on these efforts by having programs in the community called supported employment programs, and these are done through the states in order to ensure that people can work and attain their employment goals. Education with our youth is also really important, because that's another time in which people really start to exhibit signs of mental illness and or start using substances. So rates actually have indicated in our recent data, we've seen rates of mental illnesses actually increase in our youth, and then in certain areas decrease for substance use disorders, but those rates are still really alarming. So it's really important that we look at providing supported things like supported education, which is an evidence-based practice, accommodations, that we work with schools and school health programs to ensure that youth can achieve their educational goals. There are many federal initiatives that really work towards and focus on mental and substance use disorders. I'll start off with the most recent, which is the Interdepartmental Serious Mental Illness Coordinating Committee, or ISMIC for short. And what this is, it's a group of federal partners. It's led by SAMHSA, along with community members, people with lived experience, family members, providers, community organizations, and they work together to ensure that there's a shared accountability for a robust system of care, treatment, and supports that support people with serious mental illnesses and serious emotional disturbances. There are also other federal efforts, such as integrated behavioral health care, and that's to ensure that your health care and your treatment for mental illness and substance use disorders are integrated and coordinated together. We also are working on expanding the workforce to ensure that it's younger, more diverse, well-trained in substance use and serious mental illness, trauma-informed care, and cultural competency.
For more information on National Recovery Month, to find out how to get involved or to locate an event near you, visit the Recovery Month website at recoverymonth.gov.
My family and friends are always with me, no matter where I may be. Sharing stories from home helps me sustain my recovery from my mental and substance use disorder.
Hi, sweetheart.
Join the Voices for Recovery, our families, our stories, Our Recovery.
For confidential information on mental and substance use disorders, including prevention and treatment referral for you or someone you know, call 1-800-662-HELP. Brought to you by the U.S. Department of Health and Human Services.
I'd like to welcome everyone back. Paolo, you've mentioned in the last question this notion of evidence-based practice at SAMSHA and throughout the country for supported employment and supported education. I'd like to talk to you and gain your feedback specifically about individual placement and support, or IPS, and other kinds of supported employment programs. How can these be critical ingredients in someone's search for meaning and purpose in their life and recovery?
Well, IPS is one very well-researched supported employment practice that, again, demonstrates that these kind of supports can help people get and keep jobs, and particularly meaningful employment. You know, Matt, we know that the majority of individuals on Social Security disability rolls have mental illness. And so the need that these programs can help people get off benefits, become independent, fully productive citizens in the community. You know, we have too much waste of people's opportunities. People aren't in the job fields where they could be contributing to help solve the many problems that our nation faces.
Yeah, and if I may just follow up with that, because I totally agree with what you're saying. And in terms of meaning, we're talking about meaning and purpose. Just to throw out another kind of promising practice, I guess, would be more in the area of microbusiness or self-employment, which if it doesn't lead to full financial sustainability, it can often be a stepping stone.
Can you say a bit more about that?
Yeah, I'll say a little bit more about it, which is
very interesting.
Microbusiness or self-employment, it taps into someone's sense of purpose and meaning, because it is asking the individual, what do you want to do? What are you inspired to do? And oftentimes people who are in recovery, at least from mental health, are the most creative types in our society. They think differently. They may not fit into the one-size-fits-all model. And oftentimes what people say is, I want to be an artist, or I want to run my own business. I don't want to work for someone else. And so having this model allows people to explore that. And you really, you see people's eyes light up a lot of times when you ask them, well, what do you want to do? And even if you just give them a little bit of seed money, or you point them in direction of programs that already exist, like the PASS program through the government, there's incentives built into our system, especially for people who are on disability, to be able to start their own businesses.
Terrific. You know, we've all, in various dimensions of this dialogue, we've touched around individuals with lived experience, and some of us on this panel have lived experience. Can we talk about the special role that peers bring to this process of engagement, particularly around finding purpose and meaning?
So in gaining access to employment, peers can often lend experience in ways and shapes and forms that others perhaps may not. Kind of the therapeutic value, if you will, from one person in recovery to another, and help with color on what it's like to be in early recovery and what works and what doesn't. You know, overdoing the employment. Very often I'll see, oftentimes it doesn't even necessarily have to be young people, just a person in recovery that just, you know, you start to feel quite well after 30 days. Get off the streets and you're looking better. You've gained, you know, some weight, and you know, back into the gauntlet of work, and you know, 40, 50, 60 hours a week. A lot of trade type work that is very grueling and long hours, and all of a sudden recovery falls to the wayside, and what's important, what got them to that point, falls to the wayside. So in direct answer to that question, how peers can help, they lend that real lived experience, what I have been through, the minimum job wage that I took when I first entered into recovery, and how I stayed there for 2 years because it was important for me to be able to go to a meeting at noon or meet with others in recovery rather than be tied down.
Been there, done that. This is what worked for me.
Basically.
Right?
Yeah, and that definitely speaks to me as well. We're one of 3 peer-run, federally funded technical assistance centers in mental health at the National Empowerment Center. So having people that are basically role models or people to look up to. I know there's been several people who have come before me who've been just great inspirations to me in this movement. David Oakes, Judy Chamberlain come to mind. And for people to see that there's this possibility, because I was, like you, I was, in the worst of situations and never would dream that I'd be on this show and never would dream that I'd be the chief operating officer of a national organization. But to have, just to see what the possibilities are is real powerful.
And I just wanted to add one more thing. Don't be afraid to volunteer. Volunteering can often lead to gainful employment and full-time employment. There's this thing about volunteering. I don't want to volunteer. I want what I want when I want it. And just wanted to put that out there as well. I always encourage my peers to, if you can't find anything, volunteer.
The other thing with young people is to bring them back, bring people who they can still identify as their peers who are successful. Who, whether it's I've graduated high school, I've been accepted at 3 colleges, I just finished my first semester, I made Dean's List, whatever it is, things that people who can come back and talk about what they've done. And for young adults, I love the micro businesses. I can go back to many young men and women that I worked with over the years who started their own small businesses and felt really good when they could start hiring other people coming out of treatment and were in early recovery and give them the opportunity in the first job. And I've seen many successful businesses, multi-million-dollar businesses, grown that way. It's a wonderful thing to be able to share that and be able to bring it back. And at each age level and each type of disability, we have to be able to do that because they have to be able to identify with the person, the role modeling. They have to be able to say, wow, this person is like me.
I'm so glad that you brought up about volunteering, because when we think of purpose, there are other aspects than a job or employment, things like creative pursuits. So people playing music, for instance, or creating art very much can bring a sense of purpose and accomplishment to people as well. We had studies that have shown that through cooking, for instance, just that sense of accomplishment and achievement itself can bring purpose. Another aspect, family caregiving. Critical role there that also brings a huge sense of purpose. I know as a dad of 3, Oryx and I were talking about our kids earlier, the sense of purpose, meaning, and joy that, helping a family member out, it's huge.
Also, I would say that one of the things that treatment programs can do, and we do at North Star, is at least once a month, all of our students go out and volunteer in the community. They go out as a group, and we take them not always to the same place, but to see all of the different aspects of what they could get involved in the community.
This has been a terrific panel. Are there any final thoughts that you'd like to share with the audience about what we've talked about? I have literally felt the dissolution of barriers between we and them. I've heard a lot about best practices. I've heard about some really interesting and innovative things that may not qualify as best practices, like engagement in arts and finding one's purpose. Any final thoughts?
I agree with what you're saying, Matt, in regards to hope. I feel the hope here. I've found hope ever since I got into recovery. And there's something that my little core group of people say, that to those who are new into recovery and are looking to become engaged, hopefully engaged in recovery, is if you don't have any hope today, let us hold some for you. We'll hold some hope for you. And you talked about a variety of things today. We all talked about a variety of things today. If you perhaps have a child that's going to college, and I know Gail talked about that as well, seek out a particular institution that is involved with some recovery support services or has some sort of avenue for engagement so that they can access recovery while they're at school.
I really think the most important thing is people recover.
Yes.
And people, whether they come from a place of having mental health problems or substance use issues, people recover, and they are all over our community, and you won't necessarily know who they are. But don't look at people and think who are in a bad place right now and think they can't recover. Instead, if you can give them that one little seed of hope, I believe people can and will recover with all of our support, and it does take all of us to help.
And I just wanted to say, if any of this has resonated with the listeners, the viewers, don't hesitate to reach out to us at the National Empowerment Center. We have a website. Emotional CPR has a website. And we'd love to hear from you and have you get involved.
You know, NAMI used to have a poster, and it showed people with mental illness who've contributed greatly to our communities and society, and the caption was, people with serious mental illness enrich our communities. And, you know, given that opportunity, given that we can educate ourselves to lower some of the ignorance out there, that agree completely, Gail. Yes, people can recover.
Paolo, thank you for that really insightful remark. And thank you to all the panelists for a really fantastic discussion. I want to remind you to celebrate Recovery Month each September and throughout the year. For more information, visit the Recovery Month website. And thank you for joining us all today.
You've just heard from SAMSHA about the importance of having purpose and its role in recovery. For those looking for a place to connect, we invite you to check out Recovery Café Spokane. Our services are free. We offer recovery circles and classes. We also serve lunch 3 days a week. To learn more, contact us here at Recovery Café Spokane. We are a part of the Recovery Café Network.